प्रवीण सर फक्त चॅट एनेबल करू शकाल का?
It is done, ma'am. It is done.
Praveen sir, are we live?
Yes, madam, we are live.
Okay, all right. I would request Dr. Girija and Arti ma'am to just join in too. Yes. Thank you so much for coming. So welcome and thank you everyone for joining us today for this discussion on eating disorders. The week of 21st to 27th is Eating Disorders Awareness Week. And this is a topic that we very rarely talk about. However, it is very important. This discussion is brought to you by Symbiosis Center for Emotional Wellbeing. Symbiosis Center of Emotional Wellbeing was established in August 2018. SCEW consists of mental health professionals that are located at various campuses of SIU and now at SOES as well. And they provide counseling services to students and faculty. We have with us Ms. Arti Bhalerao ma'am. She's the Chief Dietitian of Symbiosis University Hospital and Research Center and Symbiosis Medical College for Women at Lavale campus. She's done her MSc and she's a registered dietitian. Ms. Arti Bhalerao ma'am is an expert in diet and nutrition. She has more than 14 years of experience in the field of diet and nutrition. She has served various corporate and international hospitals in her career span. She is working as a chief dietitian with SUHRC and is responsible for the nutritional management of IPD as well as OPD patients of SUHRC. She specializes in critical care nutrition and disease-related nutrition management. She is an amazing orator with extensive experience in handling corporate sessions related to lifestyle, wellness, and nutrition for all age group. Thank you so much for coming in and being a part of this panel, ma'am. Next, we have Dr. Girija, ma'am. So Dr. Girija Mahale is a psychiatrist and she heads the Symbiosis Center for Emotional Wellbeing. She has close to 15 years of experience in this field. She's extremely passionate about mental health and has worked in various subspecialties such as child and adolescent psychiatry, youth mental health, de-addiction medicine, etc. Her specialty area is youth mental health. Apart from MD in psychiatry from Seth GS Medical College, KEM Hospital, she has acquired her fellowship from Royal Australian New Zealand College of Psychiatry, where she extensively worked with age group of 12 to 25 years. She's a compassionate leader, ardent advocate, and teacher. Hi, and I am Srinidhi Tantri, the psychological counselor for the Symbiosis Skills and Professional University and part of the SCEW team. So now that we have introduced ourselves, we would also like to, speak about the other domains before we move into the topic. I would like to give in a trigger warning because since this discussion has some sensitive topics, I do want to give our viewers a trigger warning. You may hear some things that are sensitive in nature and may be unpleasant to hear. Feel free to step out of the discussion if you're feeling uncomfortable or start to feel overwhelmed and join in whenever you're ready. It always helps if you have a glass of water next to you. to help ground yourself, and you sit in the most comfortable position as you can. So let's just begin. Let's just get into the discussion. As this discussion, I would want to hear from both of you, Dr. Girija ma'am and Arti ma'am. We have come up with a few questions. We have curated a few questions. So let's just dive into that. The first question is, the most common thing that is, what is an eating disorder? We very commonly just end up labeling ki, that person is anorexic, that person is purging or whatsoever. But what actually is the definition of an eating disorder, and what are the types that come under eating disorder?
Correct. Okay, so may I begin, Srinidhi?
Yes.
First of all, thank you so much for the introduction and for introducing this topic, which is, as you very rightly said, very less talked about. And I'm glad to have Arti ma'am, who is such an experienced dietitian and who is such an important stakeholder in the management of eating disorders. A warm welcome to all those who have joined us today for this session. I hope that after this session, you are fully knowledgeable and you're also able to reflect on your own eating behaviors to be able to seek help if you need so. All right, so you opened up with a question, which is, what is an eating disorder? And you very rightly said that people call themselves anorexic or, bulimic, and you hear these terminologies being thrown all over, right? So eating disorder, as the name suggests, first of all, is a mental health disorder. So it is not a medical disorder. It has its roots in your mind. And it is characterized by persistent patterns of irregular eating behaviors, okay, that then start affecting your physical health, your emotional or your psychological health, and also your social health, that is your social relationships or how you deal with people in general. So as you can see, it is not just a medical problem. There is an unhealthy relationship with food, where individuals either eat too little or eat a lot, or sometimes they eat excessive amounts of food in a discrete period of time with almost like a sense of loss of control over it. And then this is a persistent pattern. So again, remember that it's not a one-off phenomena. It is something which is happening at a certain frequency and certain severity for it to then affect your physical health, which we will be talking about in what all areas your physical health can get affected. It can cause significant psychological problems, which again we will be detailing out through the session. And as I said, it interferes with your social, family relationships, etc.
What are the specific categories of eating disorders? Like, what are the types of eating disorders? Can we know a little more in detail about them?
Okay, definitely. So eating disorders, if you read the literature, eating disorders came into being in the 1950s. And that too, these eating disorders were unknown in India almost till, I would say, even now, there's not much awareness or research also in India about eating disorders. So it was more of a Western phenomena as it was thought of. And it was after the 1950s that, individuals that started identifying these eating disorders. So characteristically, they were classified into 3 eating disorders, but now we identify that there are more than 3 types of eating disorders that are prevalent. So the most commonly talked about or termed is the anorexia nervosa. However, in terms of prevalence, if you see, it is not the most common eating disorder. In fact, it is one of the rarest eating disorder in comparison with the other eating disorders.
Okay.
So I'll just first list out the eating disorders, types of eating disorders, and then give you a short description of what each eating disorder is. Okay. So anorexia nervosa, then bulimia nervosa. These terminologies may sound a little complex, but I'll explain, what it means. Binge eating disorder. Then there is also a eating disorder which is called as ARFID, or Avoidant Restrictive Food Intake Disorder. So the short form is ARFID, which is Avoidant Restrictive Food Intake Disorder. Then there are others which don't really fit into any of these categories. And that's why they're called as other non-specified eating disorders. Or there are other disorders which are not very prevalent, but where something called as pica or rumination disorder. There are also types of eating disorders. Or even pathological psychogenic vomiting is also a type of an eating disorder. But again, it does not classically come in that diagnostic category of eating disorders. Okay, I've named and I've taken fancy names. Let me just explain to the audience what each of these means. So in anorexia nervosa, essentially, the person has intense fear of gaining weight. So much so that they start perceiving, they have a perceptual disturbance when it comes to how they view themselves or how they view their body image. So they think of themselves as fat or overweight, which is what leads them to start restricting their food intake. So although they are much below the weight that is ideal for their age or height, because they believe that they are overweight, or because they have this intense fear of food, they start restricting food. In fact, they will, I have seen these clients in practice when I was in Australia, where they will not sit with their family for eating food, or when they're sitting with their family for eating food, they will hide the food. So literally, they will throw the food under the table, or they will hide it in their pocket, and so they hoard the food, literally. And again, they're very fussy about food, specific foods. There's a lot of preoccupation with food. And if they end up eating, then again, they are obsessed about whether they've put on weight. So they'll go and weigh themselves again and again. They'll observe themselves in the mirror. They will engage in behaviors that they think will help them to lose more weight. So if they have eaten a meal, then they will immediately engage in what we call as compensatory behaviors, such as purging, which means they bring up food after eating. Like they will insert 2 fingers into their mouth, to their throat, so that they have that vomiting sensation, which we call as purging behaviors. Or they may even use laxatives, so pills that help them to pass motions, so that they have this feeling that they will lose weight if they use laxatives. So there's misuse of laxatives that they do. And they also over-exercise. So exercise we often talk of as a healthy thing to do, right? But over-exercising, anything in excess is bad. So if you're over-exercising to the extent that you're losing muscle mass, you're losing the adequate nutrition that is required for your body growth, for your brain growth, or for your overall well-being and health, then that leads to what we call as anorexia nervosa. Okay, so it's a very complex disorder which is seen in adolescents. Usually the age of onset is adolescent, and these are the various symptoms that you will see. Not very often will anorexic patients come by themselves to a doctor to tell that there is a problem, because they don't have this insight that there's actually a problem. Because they feel that they are overweight and they're restricting food because they feel that they need to lose weight, and they don't have this realization that actually it can be extremely dangerous for their physical health, for their emotional well-being, and even for their life in general. So that is anorexia nervosa. Okay. Then the second category that I'll talk about is bulimia nervosa. Okay, bulimia nervosa, again, there is dissatisfaction with the way a individual sees his body, or with his appearance or weight. And they, as the name suggests, so they will engage in binge eating behaviors. So what is binge eating? Binge means eating excessive amounts of food in a discrete period of time, over and above what other individuals would eat in that duration of time. And usually there is a sense of loss of control that people experience when they're eating, when they're binge eating. So the individual will just hog on, and usually it's junk food that they will really binge eat during that discrete period of time. And following that, they have this realization, oh my God, how much did I eat? And that will result in compensatory behaviors like purging, vomiting, over-exercising, use of laxatives, etc. So it is characterized by these binge eating episodes, followed by these compensatory behaviors, which is characteristic of bulimia nervosa. So here, how it differentiates from anorexia is that the body weight may not be, they may not be underweight, or they may not be necessarily restriction of food intake to the extent that we see in anorexia nervosa. It is characterized by these episodes of binge eating followed by compensatory behaviors. Now, the third category, which is, I think, one of the very common categories that we see in clinical practice, especially I've seen that in India, is the binge eating disorder. And unfortunately, in our Indian culture, it is not looked as a problem at all. Food is something Indians are very obsessed with generally, and food is what connects people all together. And as we know in India, we are very, very fond of food. So binge eating disorder per se is again characterized. Here, the person does not really have a distorted body image, or there is no real dissatisfaction with their body image. But it is characterized by these irregular eating behaviors where the person engages in these episodes of binge eating, which may not be followed by these compensatory behaviors. So usually individuals with binge eating disorder may err on the side of being overweight or obese. There will be no compensatory behaviors, as I mentioned, in individuals with binge eating disorders. And again, the cues, the association of food. Usually when do we eat food? When we are hungry, or we eat food for nourishment, right? So in binge eating disorder, usually the individual, when he binges, there is an underlying feeling that he's dealing with or coping with, which leads to the binge. And I'll talk about that when we talk more about other types of eating issues. But that's the underlying pathology there. And then the avoidant restrictive intake, food intake disorder, where again there is no body image disturbance. So they are not restricting food. There is a pattern of restricting food intake, but that's not because they have issues with their body image or they perceive themselves as overweight. They are restricting food because they are, and this is again usually seen in children, young children, where they develop aversion to certain sensory experiences of food. So food which are, they get associated with strong smell, strong taste, they will be completely aversive to it, and they will completely avoid, like they'll just not be able to swallow, and they'll have this strong aversion to food, which will then lead to nutritional deficiencies or undernourishment and poor energy levels in the child, which then therefore classifies it as a disorder. So why is it a disorder? Because it is causing nutritional deficiencies, undernourishment, low energy levels, and which is why it becomes a disorder. I did mention pica. So pica is where it's, if I remember in medical textbooks, we were told that pregnant women usually engage in behaviors of pica. Pica is where you eat non-nutritive foods, like eating mud, for example, is what we would classify as pica. Not just once in a lifetime, but it's a regular pattern of behavior where the individual is eating these non-edible substances or non-nutritive substances, and that's called as a pica. Or rumination disorder is where the individual brings up food or regurgitates. And again, that's not because they're dissatisfied with their body image or because they think that they've eaten more, but they just it becomes an irregular pattern where again, because of some underlying psychological issues, the relationship that they have with food, they often bring up food, and which causes this kind of a problem. So as you can see, there are various types of eating disorders, and each eating disorder has unique characteristics, and that it's important to understand that it's quite common to see individuals with these problems in community. They may end up with other physicians, they may end up with gastroenterologists, they may end up with doctors, they may end up with pediatricians. So it's also important for medical fraternity to be aware that the underlying issue may not be medical purely, it may be actually psychological in nature. And it's important that that interdisciplinary aspect is considered by health professionals.
Absolutely. Thank you so much, Girija ma'am, for giving us a wonderful base to start off the topic. Now we have a very good idea so that we can now go into the various other domains and, go further in the conversation. And I absolutely agree that all parts of the well-being of the person has to be taken into consideration, because everything is interlinked. The physical ailment can affect the mental health can be the cause of the physical ailment. So I absolutely agree with you. Thank you so much. I would like to ask Arti ma'am, how often do you see students who have an eating disorder? How often is it in the youth population?
First of all, thank you, Srinidhi, for the wonderful introduction. And thank you, Girija ma'am, for making me a part of this program. And it is a lovely platform to reach out to the population. And I'm really glad and really thanks to, introduce the topic and, so that we can really get in and weave in with the important concepts. So, of course, I would say just to answer your question, Srinidhi, what is the prevalence? So, of course, like ma'am said, anorexia nervosa or bulimia nervosa or binge eating disorder. So, I would not say that, it is the exact disorder is prevalent. Yes, it is prevalent to a subset of population, but the subset of the disorder, a subset of anorexia definitely is seen in a very regular practice. So, it is all about having poor awareness, which prevents the person who's suffering from seeking help. Like ma'am said, if the person is having anorexia nervosa, probably the person might not report it to, because for them, it is just a normal way of behavior. And then it definitely, like ma'am said, it is usually these cases are referred to us by the gastroenterologist. They are referred to us by the bariatric surgeon, by the endocrinologist. And among the three disorders, which definitely are mentioned, one amongst it is more spoken is anorexia nervosa. Now, these cases are prevalent, but to a very, subset of population. And in clinical settings, we do see this a lot, but when it comes to binge eating, yes, it is quite prevalent, and a subset when it comes to restrictive eating, which I see is very, very common in today's practice. So we have a lot of aspects of our clinical practice of nutrition and dietetics, of which wellness is one. So in that, when we take the dietary recall, we definitely see that, there is a constant obsession of maintaining the weight, so not to the entire population, but yes, a subset of population is definitely, into that yo-yo dieting concept, wherein, they want to lose weight, they want to gain weight. And this is what is making them vulnerable. So if you ask me about the younger population or the students per se, yes, they are at risk of developing an eating disorder. It might not be prevalent, but yes, and awareness is going to definitely go into the longer run, because, when you are not eating your diet, which is nutritionally adequate, of course, it's going to lead to nutritional deficiencies, and these nutritional deficiencies are not restricted to any one particular organ. That is going to happen into all your body organs, affecting your all systems which are there, whether it is your GI tract, whether it is, your immunity, whether it is your, the digestion, metabolism, your, micronutrient levels, which are going to also control the decision making. So all of these are integrated towards each other. So, it might, for the people who are suffering from the disorders, who are suffering from anorexia nervosa or bulimia, one single episode of not eating properly is definitely going to impair their nutritional status to a greater level. So the earlier we seek help for them is definitely going to help quite in a longer run. So, when we see the younger population which comes to us, when, like I said, when we have the population, so I had a couple of people who pursue their air hostess, or they are aiming to become air hostess. So this trend is quite seen in those people because they are very, very, precautious about each of eating, and then you find anorexia, which becomes the risk factor to them, and they start restrictive eating. Of course, if you are seeking right help, we can educate them to eat right and still be healthy. Okay. And of course, when we see today's population, yes, we are all habituated to the internet and, the apps that give you an unrealistic goal of achieving the ideal weight, whether it is your looks, whether it is your skin, your health. So then you'll end up not accepting yourself how you are. So what I would like to suggest over here is, being youngsters, there is much more to contribute to the world and the universe beyond the physical appearances. So this definitely, physical appearances are not something that is going to restrict your existence or your capability to express yourself. So yes, binge eating, of course, when we have our own clinics, we have a lot of patients who are referred for weight loss, who are referred for bariatric surgery. So, we have had histories wherein there is binge eating, which is associated, and then the BMI reaches to a higher level. And this is seen in an early population as early as 16, 17 years of age, where, the obesity becomes a problem. And then the people opt for surgeries for, kind of losing their weight, because yes, the aspirations to the future are there. But the prevalence, definitely, as you asked, is something which is increasing, and the right kind of approach when it comes to an integrated approach, that definitely helps us to deal with it. Now, when the people, when you take their history, they are very sensitive when we are talking to people who are at risk or, are suffering from this disorder. There's a dual pressure, like ma'am definitely mentioned in her, conversation, that these people are very sensitive to what they eat. They don't want to discuss what they're eating. They don't want to discuss about their diet. They are under dual pressure. One is they are suffering from it. Two is they are wanting to hide from it. And as the period prolongs, it's going to be, making it more severe. And, the earlier they seek the help is going to be better. Is what I would like to suggest. Yes, binge eating disorder is very common, which is very prevalent, and the subsets of it, like, if a person is seeking to go into sports, so, to fall into that category, they start restricting their food to, fit into that category. But when you're not eating, you don't realize that, if your diet is not nutritionally adequate, it is going to affect much beyond you feeling unwell. If it is your skin, your hair, your immunity, and if it is unattended, it is going to lead to certain irreversible changes which can turn fatal. So this platform, as we go ahead, we are going to in detail understand, what are the implications of it, so that, we are keeping away from these kind of disorders. We have a definite bright future, and so we are here all together to see to it that we are all healthy in it, and we are in it together to deal with these kind of disorders. Thank you.
Thank you so much, Arti ma'am, for giving such a detailed explanation about the same, and understanding the prevalence across the age and across the categories, and what types are most common and prominent. So thank you so much for the explanation and for the discussion. As you had mentioned, and as Girija ma'am also mentioned, I'm just going to mash up both. I'm going to take up both the points. First one is, Arti ma'am, you had explained about, you just described the yo-yo dieting. This is something which we have very commonly seen. And Dr. Girija Mahale also said that in the Indian culture, we are very fond of food. It's very easy to get hooked onto food, we feel that it is a part of lifestyle. That's all right. So I would like to ask Dr. Girija this question, that yo-yo dieting and preoccupation with food is nothing new in our culture, right? But when does the focus on food, calories, weight become a health concern? Is there a difference between an eating disorder and disordered eating?
Correct. So that's a very, very pertinent question, Srinidhi. I think, human beings require food for nutrition, okay, and growth. right? So there are regular times of the day. So 2 meals in a day, 2 to 3 meals in a day is what is ideally required. When your eating becomes irregular, when you have irregular patterns of eating, like you're skipping certain meals or you're having one large meal only in a day, which is again, it is not reaching to the extent of causing a eating disorder where, you're not having all the physical health concerns, or it's not happening in the same frequency or severity which we would classify it as an eating disorder. But there are these patterns of eating behaviors which are irregular, then we would call it as disordered eating. So, where you're not using food as a means of nourishment, or you're not really listening to your hunger cues, you're eating as and when you're feeling bored, you just resort to food, or when you're feeling stressed, exams ke pehle, you go and hog food, or you're just, your eating is not done mindfully. So you're just eating, and you don't have that realization that what are you eating for. Then that can become an unhealthy pattern, and that is what is called as disordered eating. And there is definitely a risk to develop a eating disorder. So you will see a large number of clients who have disordered eating behaviors. Not every one of them will develop a eating disorder, but they remain at risk of developing an eating disorder. And certainly disordered eating patterns can be quite unhealthy, because if you're not eating certain food groups, for example, so disordered eating also involves not eating certain food groups, or eating only certain food every single day. Then you're not getting the required proteins, carbohydrates, micronutrients like vitamins, minerals that are essential for your healthy growth, which can then lead to a myriad of health problems. As Arti mentioned, food is not just nourishing, your body appearance or your external features, but it's nourishing your heart, your brain, your kidneys, your nails, your skin. Each and every organ is where, your food is absorbed from your gut, and then it is taken by your blood to all organs of the body. So people with disordered eating will have problems in various health areas, and not just with their weight. So it is not a weight issue per se. It is an issue with regards to their eating habits, which can then cause these physical health issues or endocrine issues, which we also again see a lot of young girls with PCOD, metabolic syndrome. And again, the underlying issue, if you just go to a gynecologist and start hormonal pills, that is not going to unfortunately solve the problem. You do require, you have to look into the eating patterns, what is causing that metabolic syndrome, what is very important. So that history taking, that right amount of counseling, understanding what is causing those eating patterns is extremely important when we look at disordered eating. I hope I've answered your question.
Yes, absolutely, absolutely. Thank you so much. So I think we have already touched base that, in a clinical practice, what is the prevalence, what can be over the age group. But I would like to ask you personally, Arti ma'am, that in your clinical practice, how much disordered eating have you seen? We covered the eating disordered
Yeah.
for this one.
Okay. Thank you for the question. And eating, like it is linked to a lot. Like you only started it that it is more linked to personal emotions. So in India, we perceive, in India, everything is related to food. If we are happy, we eat food. If we are sad, we eat food. If we are bored, we eat food. Okay. And of course, we never pay attention of what is going. If you plan your day, but hardly you will find people who will give you a history that they are planning their food, what they are eating and what they are not eating. It is mostly an unaware eating or habitual eating that happens. So, it is also, not only related to the personal emotions or the comfort, but it also stimulates certain chemicals. It will stimulate endorphins, which is going to act as a reward to your brain, or it is going to act as a bribe for brain. And how this is how the food is also utilized in our day-to-day life. So if you ask me in a clinical practice, because we've been counseling nutrition across all age groups. So disordered eating, like Girija ma'am has already explained. So it starts from, I would say, right from the weaning age, because there is a lot of restrictive weaning type of food which starts, many a times the mothers have to be counseled of what food to be given. So we do have a history where the patients come to us that the child is refusing to eat the food at all. The child does not want to eat solid food when the child is having all the teeth intact and 2 years of age of child not eating food. So they are being referred to the nutritionist. So here what happens is, because of the poor awareness, the child is repetitively given liquid foods and the same bland food. Then the child develops aversion towards food. If you're not habituating the child at the right age, then the child rejects the food. So it is then, and then comes the children. So when it is young children, it is a comfort given to them. Yes, if you're not listening to me, this is what you are rewarded with. And then starts the binge eating food, and the child refuses to eat normal food. So we do have parents coming to us stating that we don't have good healthy eating habits in the child. A lot of faulty eating habits when the child is in front of the screen and starts eating. There is where he loses whether I'm eating as per my appetite. If I'm full, I should stop eating, because you are too much into emotions and then you start eating food. Then like ma'am did mention, a lot of metabolic syndrome, which we definitely see, and it is quite prevalent, and the roots to it are definitely the underlying psychology of the person, which plays an important role in the food acceptance, which is there. So we see a lot of pre-diabetes cases in nowadays, and of course, when we take the diet recall of these patients, so they are into this phenomenon of losing weight, gaining weight, and then they would start restrictive eating, and they have periodic episodes of binge eating as well. So if with this phenomenon, they are, wanting to have a particular weight, but not able to achieve it, with getting distressed with this phenomenon, they start eating more. And, once then they realize, and then they are, kind of coming to us for counseling. So it is prevalent in adolescents, of course. Every small inch into their, the size in which they are trying to fit in yourself. So if you're not, typically this I've seen in youngsters, the concern becomes all the more if you have your older clothes and you're no longer able to fit into those clothes. And this is a very sensitive to the adolescent population, because see, it is not fitting into the earlier sizes. It's not something related to only dietary pattern. It is the amount of hormonal changes, the physiological changes, which are natural to happen. So probably if we are not educating them at an earlier stage, yes, these are certain things, and we need to look at ourselves as individuals beyond the bodies. I guess, this is going to resolve that issue. So we do see the prevalence into adolescents, and, as early as 13-year-old, we've seen pre-diabetes setting in, and some amount of it is also dedicated to the restrictive parenting or a strict parenting pattern when you're in control of the entire habits of the child, right from sleeping to each and everything. So then the child finds comfort in the food, and there is where you have the cause to start on binge eating, and then you have the reciprocations of it in terms of obesity, in terms of puberty growth, in terms of their menses which get affected. Apart from just getting fatigued or losing hair or losing the gloss over your skin, these are superficial things, but they do affect the individual at a metabolic level, at a hormonal level, to a very great extent. And further going, see, it is not only the younger population, it is also during the middle-aged population that you see these subsets, because by then what happens is we don't eat right. So if we are not eating right, your body composition undergoes a change. So wherein if you're losing your muscle mass, if you're gaining too much adipose tissue, you tend to put on more of weight. And during the middle age is when, you know, you realize that your BMI has really grown up high. And then is where I again find people going on restrictive diet, people going anorexia, people start, you know, restricting their diet intakes. Like ma'am said, you know, certain diets, when I take the recall, you'll be surprised to understand that there's one diet wherein it was just an apple and, you know, tea that the patient eats for the entire day. You know, this is what the extremes of you know, the prevalence goes when it comes to understanding your own body figure. And see, in a clinical setting, you will always have these kind of anorexia in subsets where it is a critically ill patient, you know, where the pain is so much that the person, you know, owing to the critical illness, gets tracheostomized, and then he wants to start with eating again, and then the fear of getting something stuck into his throat will avert the patient from starting a solid food. You know, at a clinical setting, again, there is a subset which does belong. I have seen all this pattern also in postnatal cases, because that is another sensitive area where, you know, there is a lot of hormonal change into the female, and you tend to gain almost 10 to 12 kgs of weight during your pregnancy, which in itself is not acceptable at times. And postnatal, then they are, you know, wanting to get back to into their original shapes. But then, yes, that is a time when your body is going to deposit your calories for your own replenishment of the nutrients that you have lost and for the child to grow. That is a natural phenomenon that is occurring. So yes, during postnatal phase also you see these subsets which you know are at risk. This population is at risk. That's why education of them at every stage in a holistic manner, you know, as a medical, you know, from a psychological aspect, from a nutrition aspect, you know, is very important when we go into it. And of course, you know, unsaid is the obesity. So all those people who have higher BMI definitely are at risk of developing these disorders. And you also see a lot of post-bariatric patients. So we have bariatric surgeries, and post that surgery, the patient becomes extremely fearful. You won't believe, you know, when people come to me for weight loss, you know, the first sentence is that let us understand you beyond your weight. Let us understand ourselves. What is my body composed of? Why am I obese? What is that is triggering my obesity? And then you literally have to tell them that you cannot lose your weight by not eating. You have to eat right to lose your weight. So, you know, this is what, speaks about the restrictive eating in the Indian population. And it is truly said, you know, very common, you know, it is almost 50 to 60 patients, percent of patients which I see have to be counseled about eating right. So I guess, and last but not the least, yes, the geriatric population, because they have their own concepts in mind, you know, they need a lot of attention. So food becomes a factor wherein they are going to show their emotions. They are going to be restrictive about food, thinking that they should not be obese, they should not be dependent upon each other. And sometimes they just lose the desire to eat. And a major part of it is definitely related to their psychology, their emotions. They are wanting to be spoken to, they are wanting to be heard to, which you know, resonates into an eating disordered pattern. So yes, this is what I would want to add to with the prevalence which is there. I'm sorry if I've taken some amount of time to elaborate over it.
No, it's all right. Thank you so much. But we have a lot of topics that we want to delve into. So I think we'll continue with the discussion. Thank you so much, Arti ma'am, for, you know, giving us a detailed explanation. This was really helpful. So I would like to ask Dr. Girija, the continuation of the same question. How many disordered eating versus eating disorder have you seen in your practice or during your career rate?
So, as you mentioned in my introduction, Srinidhi, I was in Australia for 8 years after completing my MD. And honestly, when I did my MD in psychiatry from KM Hospital, eating disorders was never emphasized in our curriculum, and nor did we see any clinical patients in our OPDs or IPDs. So we did not, eating disorders was always like thought of as a Western culture, Western phenomena. not to be really assessed even in our history taking. But when I went to Australia, it was an eye opener. And when I used to see these young clients, adolescents with BMI low as 11.5, 13.5, really struggling, with having so much of fear about food, eating. That's when I realized that it's really quite prevalent, not highly prevalent, quite prevalent in the Western world for sure, where they have specialized eating disorder units for the treatment of patients with anorexia nervosa or bulimia nervosa or the binge eating disorders, right? So there are outpatient clinics, there are inpatient specialized clinics where certain individuals may even require hospitalization for their treatment, because if the condition does become severe, if your BMI is really below a certain level, or if your heart rate, because when you start restricting food, as I said, it affects your heart. Your heart rate can go low, your blood pressure can drop, your bones become very weak, very, very important. Your vitamin D, calcium levels go low. You can develop osteoporosis and fractures. It can affect your hormonal health, where girls can lose their periods altogether. They can develop facial hair because of the hormonal disturbances. They can have severe electrolyte disturbances. So their potassium levels, sodium levels can all go haywire. And that can cause acute confusional states. So the person can become quite disoriented. The hair become very brittle. They will start to lose hair. Nails become brittle. Their GI tract, so digestive problems, especially children who have these purging behaviors. They can even develop erosions or ulcers in their stomach, or they can have problems with their teeth because of the constant purging behavior. Your teeth can get eroded. So you see a range of these disorders in the Western culture. I've seen right from mild eating disorders to severe eating disorders. And I was particularly working in that specialized eating disorder unit when I did my child and adolescent psychiatry training. So I've seen these clients very closely. After coming to India and I started working with Symbiosis, I was taken aback. I did not expect, to be honest, to see individuals with anorexia nervosa or with any other eating disorder. And when I did start seeing them, it did seem that we have we are now living in a globalized world. Western influence is definitely taken on, and the social media and digital technology has brought us all very close. So the influence is definitely there, as Arti mentioned. Media influences, definitely the body image, and youngsters especially become, as it is from when you transition from childhood to adolescence, there are a lot of physiological changes, and you become more conscious of how you look. And it's also a phase when you're developing your identity, and appearance becomes hugely important. But again, the overemphasis or the overvalue that you give to thinness, so much so that it becomes internalized within an individual. Like thinness becomes an ideal for you, and you start, then obsessing over your weight, obsessing over your food, and food becomes a matter of stress. It's no longer becomes a source of enjoyment or pleasure, but it actually becomes a source of stress, where eating absolutely becomes a stressful thing. So you do see these individuals in clinical practice, and we are seeing, again, previously it used to be thought that it's only seen in girls or it's seen in certain professions. But as Arti said, it's seen across age groups. It's seen in males, females, people of other genders, LGBTQIA plus community. So it does not spare anyone. Also, previously it was thought that it is only affluent people because of the fantasies over food, they will develop. But again, it's, as she said, the restrictive food types, or they're seen in all socioeconomic backgrounds as well. So we are seeing increasing prevalence, but education about it is definitely lacking.
Absolutely. I agree. I absolutely agree with the point that, idealization is given more importance rather than individuality and, making your own personality or coming up to that. So yes, we are very much influenced by the glamour and whatever the other person is doing. And yeah, so that is there. Thank you, ma'am. Arti, ma'am, I would like to ask you, given its nature and its effect on our well-being, so we have covered a few points on how it affects us physically, but what other aspects which are very commonly seen, and how does it really affect us developmentally, physically, and hormonally, and so on?
Thank you, Srinidhi. And, basically, ma'am has covered a lot of the physiological effects of it, See, we are, what we eat, is what is commonly said. So every nutrient is very important. So when you have, an eating disorder, suppose we take the example of anorexia nervosa. So it's going to lead to, less of diet intake, and of course the nutrient intake. And because of the intake which is inadequate, it definitely can lead to hair loss, chronic fatigue. It is going to lead to a loss of the heart tissue, and the person into it is not able to manage the body temperature, and there is where you have these facial hair growing up or body hairs which are growing up. It goes to the loss of menstrual periods and osteoporosis which is there, and you're losing your muscle mass. So the biggest fear over here when it comes to seeing a person with anorexia nervosa is, see, 10% of muscle loss, yes, I am able to intervene. 20% of it, yes, I start the dietary intervention and immediately I see the benefit of it or the effect of it on the patient. So if you're planning for an intervention, so when you're losing your weight, you're not losing your fat percentage only. You're losing fat is the last thing that you lose. What you lose is first is your water mass, and then is your muscle mass. So if your muscle loss is more than 30% of your total weight loss, it is usually a skeletal muscle mass which is lost. And at this moment of time, if I'm asked to intervene, no matter how much I put my skills and how much ever I try to feed that patient, it is of no use, because it becomes irreversible and it can lead to the loss of life, which is very grave. And that is what is the most concerned part when it comes to eating. And that's why it starts with very simple thing, that even if it is an eating disorder or a disordered eating, it has to be tackled at that level. So it can be that grave. Of course, when you see the younger population, like we spoke about the weaning dads or the pediatric population, their growth is very vital. And at that moment of time, you should be making them eating right. So if it is a patient who is referred for a weight loss during their child age or pediatric age, so and giving them a restrictive diet is something I thoroughly don't practice. So it is about making them eating a balanced diet. So for that population, this major of exercising which is recommended. And for restrictive eating, you really have to talk to them. You have to open up to them when it comes to children. So they will be having an aversion to food with a specific reason, like Dr. Girija also mentioned. It could be psychological, it could be something related to memory, it could be something wherein the child was threatened for a particular food, and that's why he is refusing that kind of food. So once he grows adolescent, you have to, or into a child group, you have to talk to the child, what is the problem. You have to educate him that yes, this is the food and this is what it is going to give you, and this is what you want. So beyond the muscle mass, the development at a mental level, the brain size of the individual itself depends upon what is your nourishment status and how well you're eating. Again, a small nutrient like we talk about B complex nutrients, and B12, one of those, which is a neuromuscular kind of nutrient. So absence of this is going to lead to confusion, loss of decision making, you having GI problems, you having cramps, small nutrient. So if you're having a loss of nutrients on a daily basis, of course, with every day passing, it's going to affect your nutritional status, which definitely is going to lead to sleep disturbances, and at a physiological level, at gross and at your cellular level. So if you see each and every cell of yours, if it is into a stress, it is going to develop mechanisms to protect yourself. And then you see it just goes beyond physical interventions, and then you're not able to control how much ever you do physiological intervention. And feeding the patients again is a challenge, because you have the risk of refeeding syndrome if it is anorexia case. If it is bulimia nervosa, then you will have, swollen salivary glands, and your digestion starts right from your mouth and it goes throughout the GI tract. So if you're exposed to a lot of purging, and then your acids it's going to affect your GI tract lining and the absorption of your nutrients at large, the absorption of your calcium, absorption of your B complex nutrients, and that is where you find the complications related to the B complex deficiencies, whether it is glossitis, whether it is gastritis which is there, or the ulcers development which is there. So this again is related to bulimia nervosa, and in combination to both, the common disorders when it comes to the nutritional deficiencies would be, iron deficiency anemia, which is very common, which affects again, your shortness of breath, or you feeling fatigued, unable to have stamina into your daily routine activities. Of course, like ma'am mentioned about your potassium, and potassium being such an important nutrient, any hypotension or hyperpotassium, hyperkalemia or hypokalemia is going to lead to cardiac arrhythmias also. Of course, if it is binge eating, then your dental issues come into more of into more of scene. So you will have dental caries which are there. Constipation is because the intake in itself is low. So your constipation is one of the major important factors wherein you are not able to eat because you're constipated. And then if it is long-term constipation, you hide it, then recovering from it is might seem a small problem, but the person who suffers from it understands it becomes much of a complicated problem wherein you need a therapeutic advice and you need a dietary modifications into the fiber to resolve that issue. Now, when it comes to binge eating, you will find, because if it is bulimia or if it is binge eating, you are, in case of bulimia also, you are retaining, because even if you're purging it out, you've absorbed the nutrients, so of course it is going to have an impact on your BMI, on your weight as well. So with binge eating or bulimia, you will find people having an increased weight gain. Now that increased weight gain, of course, it is because of the faulty eating pattern. So it is going to lead to more of fat deposition, which is going to lead to hypertension, dyslipidemia, osteoarthritis, having a fatty liver, atherosclerosis, you developing a risk of diabetes, sleep apnea, and to some extent also development of cancer. So these are, an awareness. These are certain things which can predispose. You're just letting it go. हाँ fine, नहीं खाया है मैंने तो क्या फर्क पड़ता है? या फिर the psychology is कि ठीक है मैं अभी खा लेता हूँ and I'll see what I can do later. So these can have a lot of physiological effects on one individual.
Thank you so much for explaining in detail. We had thought that there'll be like common factors, but you explained it so nicely that every single type of disorder may have their own unique set of consequences. So thank you so much for explaining that to us. And I would like to ask Dr. Girija also the same question. What are the psychological areas of harm which are caused by disordered eating as well as eating disorders?
Correct. So mind and body are very, very closely related. When your body is not functioning well, definitely it's going to impact your mind. And likewise, when your mind is not functioning well, it's going to impact your body. And you see that very beautifully in eating disorders, where problems with your mind lead to eating disorders, and then eating disorders further leading to mental health issues. So people who have eating disorders definitely can have problems with anxiety. They are predisposed to developing depression. They have developed a low sense of self-worth or low self-esteem, which can again be very, very risky, because such individuals then can often have suicidal thoughts, and therefore the risk of suicide is also quite high in individuals with severe eating disorders. So a range of mental health problems can be seen. And mental health problems in itself predisposes individuals to eating disorders. So people with certain personality types are particularly predisposed to eating disorders, like people who have perfectionistic traits or who have problems with regulating their emotions. They have emotional dysregulation problems. or who have severe anxiety, or who are quite impulsive in nature, are actually predisposed to developing eating disorders. And a large number of eating disorder individuals also have problems with emotional dysregulation, problems with impulse control, as it affects your brain, right? So if you don't have the right nutrition that is going into your body, it's affecting your ability, your frontal lobe, your executive brain. And that's, adolescence is the time when your executive brain is developing. So if you're not getting the right nutrients, then your ability to make decisions, problem solve, plan, organize, all that takes a beat. Children are not able to concentrate, their attention span is affected. So all these can be the various psychological impacts of eating disorders.
Yes. In continuation to the same, I would like to ask you, what can be the cause or triggers for eating disorders? Because in the very beginning, we had mentioned that it is a psychological disorder.
Yes.
So what can be the triggers and cause for the same?
Correct. So there's not one particular cause of an eating disorder. It is what we call as a multifactorial. That is, there are various factors that can contribute to it. And there could be problems with your brain in itself. So biological factors, what we call as, where there could be some neurotransmitters that are involved in causing the eating disorder as such. But more so, as I mentioned, the psychological factors, where certain personality types, if you're very perfectionist in your thinking, then so certain thinking patterns can predispose you to developing eating disorders. Then there are a large number of social, environmental, or familial factors. The family plays a very important role in your eating habits. And again, coming to Indian culture specifically, I think we are fussy. We are, Indians fuss about food. Right from the time a child is born, they will be, and that's a huge contrast again between our culture and the Western culture. Indian mothers versus Western mothers, they will keep the food in front of the child, you eat, and you're done. Indian mothers forcing food into the child's mouth. नहीं खा मेरे बेटा कितना दुबला पतला हो गया है, खाना चाहिए बेटा, खाना चाहिए, खाना खाना खाना, all the time just emphasizing food, or controlling parents, as Arti said, where ये करो वो करो, ये नहीं करना चाहिए, वैसा नहीं खाना चाहिए, too much obsessing about healthy food also. बिल्कुल जंक नहीं खाना है, नहीं तुमने ये खा लिया तो तुम्हारा अभी कैसा वजन बढ़ गया है, देखो शादी कैसे हो जाएगी, what will people think of you, सब लोग बोल रहे हैं कितनी मोटी हो गई है. So labeling, judging, all this has detrimental effects on the individual's mind, because then they start internalizing all these feelings. कि हाँ सच में, I don't look good, I'm not appealing, I'm not attractive, and then that unhealthy relationship with food starts. Also, the pattern in the house itself, like if you're bringing in a lot of junk food and hoarding it in your house, and you yourself are not the ideal models for eating habits, then that's going to create a culture where the child is also going to pick up similar habits, and then the parents will again reprimand the child for putting on weight, or not being that ideal, having healthy eating habits. So parenting and family environment plays a very, very crucial role in developing healthy eating habits. And I cannot emphasize more on that, how much influence it has on the child's psyche. Okay. Then social influences, of course, as we very well know, certain professions are more vulnerable. Ballet, dancers, dancing is itself, where again you are expected to be of a certain body weight, or people doing modeling profession or working in media. Again, there's an emphasis on how you look, emphasis on being very, very thin, then again predisposes you to eating disorder. So there's social, familial, psychological factors, there's genetics, gender, yes, because again, females, there's more emphasis on body image and appearance, cultural, contributions to it as well. So it's a multifactorial bag which can predispose you to an eating disorder.
Yes. So from what I gather, it's everything that can impact, and anything and everything can actually trigger a person to developing an eating disorder. So it may be your family system, may it be your environment, may it be your genetics and many other areas, right? So how does a person who may have ED, or how does eating disorder affect the interpersonal relationships of the person who is undergoing and so on?
So it's very complex. As I said, eating disorder, a person with eating disorder has faulty eating patterns, right? So the family or people around this individual see that this individual has some behaviors which are odd. So either this individual is overeating or is undereating, and therefore they're likely to be targeted by the family as, this मेरा बेटे को कुछ problem है, he doesn't eat well, या बहुत ही खाता है या खाती है, and then they start judging the child, which then further impairs their self-esteem, impacts their self-worth, and then that creates stress and further creates a vicious cycle where they further engage in this behavior, because that is the underlying factor for the eating disorder is their psyche, that they're coping with these negative feelings through the medium of food, or their negative perception of themselves is a contributing factor for their faulty eating behavior. But this is further perpetuated by the faulty communication that is happening, the unhealthy communication that is happening. And therefore, then what happens, the individual feels isolated, feels lonely, and then gives rise to interpersonal problems. So the parents don't understand this, that it is a much bigger problem than just the weight or the behavior, and that there is an underlying whole psyche that is involved, which needs to be looked into. So that impacts their interpersonal relationships. Also, kids with, because they have low self-esteem, they will have problems they will feel that they don't fit in with a peer group. They may develop social anxiety. They may get bullied by their friends for being a certain weight. Again, in schools, we see that very often. Clients who come to me with, any other disorder also, who have had negative experiences in school because of their weight, where they're bullied either by the teachers or by their peers, definitely they develop these unhealthy eating behaviors, or they develop other mental health problems, which can be quite detrimental in the long run. So you have to see the long-term impacts of these, communication that you have with individuals, how it is internally affecting them, and how much of a problem it can cause to that individual. Yes. One needs to be very mindful of how you communicate with individuals about their weight or about their eating. Even healthcare professionals, for that matter, I've often seen, doctors judging their clients about being overweight, kitna wazan, and passing nasty comments. I mean, not even, sometimes you don't even have this realization how much impact that individual must be impacting that individual, because already they're struggling with poor self-esteem, and even a small remark like this can absolutely be triggering for them, which can further be detrimental, both for physical and mental health.
Absolutely, absolutely, very true. Thank you so much, ma'am. I would like to ask Arti, ma'am. Ma'am, the discussion that we have had till now, it is very obvious, or it is very prominent that in India, the eating disorder rate has been increasing. So what can be the factors that it is increasing, and what is the role of a nutritionist, and what are the intervention plan a nutritionist can implement in this situation?
So Shrinidhi, in India, when you see, like ma'am has mentioned already, the causes behind it. So one way that the child looks at it is coping up, when it comes to adolescent, that is the way in which they see it is a controlled parenting in most of the Indian families. So तुम नहीं जानते तुम्हारे लिए क्या सही है, मैं तय करूंगा तुम्हारे लिए क्या सही है. बच्चा बेचारा क्या करेगा? In school also, the child is also not into a, he is always on the receiving end, whether it is the principal, whether it is the teachers, whether it is a peer. And this then, for them, the child finds comfort in the food. It finds a release in the food, which is very typical to our Indian scenario. Then, like when ma'am mentioned, our weight is not our ownership. It is a social ownership. Everybody owns our weight. how much I should be weighing is not something that I am going to decide. It is somebody else who thinks that I should be losing weight. And my internal, appearance is going to be, and like ma'am rightly said, it is related to your professions also. If you look like a healthcare professional, what sense does it make if you're overweight? These are the comments which pass. See, this could be a normal comment for anybody, but person who's actually suffering from it, who's really into that problem, one single comment is going to make that person isolated. It's going to make him binge eat. It's going to make him, skip his meals, and don't know to what period of time is the person going to continue to it, and nobody might notice it. That is the Indian risk when it comes to. And third is related to socialization of food. Like I said, if we are happy, if we are bored, if we are, too overwhelmed, food is something that comes to our mind. And to a lot of it, it really depends upon the respect. So if I'm making certain food, if, there is a relative at home and she's made something for you, or he's made something for you, and if you're rejecting it, then it shows some disrespect. So you cannot disrespect. So the people who are into this disorder or disordered eating, for them it becomes a very big factor for guilt. It cannot be left open. You not eating a particular food is a common phenomenon. If I'm not hungry, that's fine, I'm not eating. It should not be linked to the respect that a person has. I think it has got two variable things into it. So that was one aspect when it comes to an Indian scenario, which is very specific to our own scenarios which are there. Now, it also depends. If I see the youngsters, yes, I would like to mention that a lot of it depends upon the psychology or the interpersonal relationship. So in today's generation, it is very common that you have somebody who you like, or, you want somebody into your life, but a rejection from that person, definitely leads to a lot of risk. And I have seen people who are losing like 10 kgs, 12 kgs of weight, and when you go drill down and you find everything normal, and the person is just rejecting the food because he's had a breakup. And it is not restrictive to a female population, let me tell you. It is the opposite gender also which is equally affected. And a rejection then relates to a body image. I'm not accepted because of my body image, so I want to gain that weight so that the person comes back into my life. It's a very small fragment of this discussion, but yes, there are prevalences in this accord. So when you really ask me what is the role of the nutritionist, and like ma'am said, it is an integrative approach. So in today's practice, when we see healthcare, it is not one single specialization which comes down. It is an integrated approach, and we are very fortunate that in India we are understanding this concept. We at SUHRC, I would definitely like to tell you, Srinidhi and Girija ma'am, and on this platform, that yes, every disordered eating is something which is referred to a nutritionist, whether it is a doctor, whether it is a gastroenterologist, whether it is a physician. So it is referred when it comes, and we are able to intervene it. But on that note, what a nutritionist is going to do is she's going to take you a detailed history. She is going to be one who is going to be very much comfortable when we are talking. So not only the diet recall, but the way in which the nutritionist makes the person comfortable. She is the one who is going to make you understand and make you acceptable. So when these cases come, we are the ones who understand. Let us understand your body weight. Let us understand where it is coming from. That's okay. Whatever you're doing, it's not right. It is not wrong. It is just which is prevalent, and let us accept it. And you're not into it alone. We are there as a team. So she is the one who's going to understand the behavior through her diet recall or the assessment. She understands the history. She goes back to the psychologist and tells, see, these are the trigger factors. What this is there, what are the measures that we can take. She goes back to the physiologist or the clinician, and she states, see, these are the biochemical parameters that are affected, and what from the medicines we are going to do, and what from the dietary factors. So her role is to open up the client, to go to the basics and understand, and be very passionate and receptive and positive about it, and then intervene. See, I understand my patient could be overweight. So if it is underweight, for me, making the patient eat is going to be a challenge, because refeeding is another thing. So if a person is not eating, I cannot make him eat the entire diet the very next moment. So it has to be in a controlled manner. So you need to understand various therapies about intervention. So we start with a gradual therapy, then we make them attain weight, and it is not just one sitting in which, you know, the role of the nutritionist is over. It is going to be a long-term consultation wherein, you know, you have smaller goals, you know, tell them and educate about the food, their perception. The basic problem is their perception towards food, you know, is wrong, that this is something that's going to harm my body. And then you have to change the perception, you know, how nutritious the food is and how the food is going to make you feel better, make you look better and give you a social acceptance, and more so helping you explore beyond your physical appearances. So yes, as a nutritionist, I feel, you know, she is a very dynamic, you know, kind of health professional, where she is associated with the clinical team to very great extent, to a psychological factor, and again to nutrition to a greater aspect. So our intervention comes when we are assessing it first. So we have to assess it right, then we have to plan for the intervention, and once we are planning for the intervention, you have to go towards monitoring of these patients, and it is long term, like I said. Vice versa, when it goes to bulimia or binge eating, where the person is overweight, then you have to cut down, because the binge eating, the person might eat more than 2,000, 3,000 calories, which is more than that. So, you know, the appetite has stretched that much. So here comes the role when she tells them to see, following a diet or asking me to follow a diet is very easy, but the challenge is to control the appetite. So in the counseling, you have to tell them that if you're eating right, if you're eating proteins, if you're eating fiber, you are not going to feel hungry. You are going to, you know, control the amount of other chemicals that are released into your body, which is leading to uncontrolled hunger. So how a particular ingredient into your food is going to make you eat. And if you're explaining this kind of food science to the patient, you definitely are into a position wherein the person is going to listen to you, because he knows that you're the one who's concerned, whom he knows that he is guided right. So that is where the role of the nutritionist come in. First is the macronutrients that I have to manage. First is the basic nutrients that I have to manage. Once I have managed that, then comes the micronutrient that is to be managed, and then setting the client at a desirable weight and helping him throughout the maintenance phase. So that long term, the role of the nutritionist is what I see and I could suggest.
Thank you so much, Arti ma'am. From what I gather, a nutritionist literally has to wear a lot of caps. So from this role to that role to that role, right from a person who gives an empathetic space, a safe space, to someone who is an educator, to someone who provides the clinical intervention. So there are like multiple roles mashed into one is, you know, the actual role of a nutritionist here. Thank you for the knowledge. Dr. Girija ma'am, I would like to ask you, for an individual, what are the early interventions that we can provide, you know, the psychological aids that we can provide for them?
Sure. So we're coming to the treatment part now.
Yes.
But before we go to treatment, I think I'm a strong believer in prevention. So what can be done? Firstly, can it be prevented? Yes. Early on, if you set the right eating habits, as I said, a healthy culture in the home, you know, and happy home, with the right eating habits, if you set the culture right in the family, then you know, majority of the problems, once an individual develops a healthy sense of self-esteem, you know, then it is half the work is done, I would say. So it's very important that families are very mindful of how they communicate with their children. If they don't think that a behavior is right according to them, then there is a way in which they can communicate. You know, never be very critical of them as individuals. Never tell them they are good for nothing. Never tell them "Aapka kuch nahi ho sakta hai," nobody will accept you. All these statements are a must, complete no, right? So please, you know, family members, be mindful of how you talk to your children or how you talk to each other. Be respectful of each other, be kind to each other. That will give you a long way in, you know, giving you good health in general, physical or mental health. So that's a very important prevention strategy. In terms of eating habits, particularly, again, I think starting early, on how you inculcate those eating habits right from an early age, again, is very, very important. So everybody is sitting and eating food at meal times, specific meal times. If you can have one meal where the entire family sits together and eats, not having meals in front of TV or any media or any screens, not having your mobile phones next to you. Even for working professionals, I see they're working and eating food. No, do not do this. Mindful eating is very, very important. Involve all your senses, enjoy your meal, see your food, taste your food, smell your food, feel your food. And that's very, very important, because that will tell you when you're hungry. That will make you aware of the physiological sensations that are associated with eating. You will also then realize, what you're eating, when you're eating, how you're eating, what foods you're fearful of, what are your trigger foods, etc. So that brings me to the early intervention. So if you then are into a habit of mindfully eating, then you will start noticing, or you'll start realizing where it is becoming a disordered eating. Okay, if you do realize that, that's the earliest phase for intervention, where again, early intervention would involve maintaining a food diary. So writing down what are your patterns of eating, when you're eating, what you're eating, how much you're eating, portion size, etc. What are your fear foods, especially in case of anorexia nervosa? What are the foods that you're avoiding or restricting? What are your trigger foods? What are the various triggers for you to eat, especially when it comes to binge eating or for bulimia? Or in avoidant restrictive, what is it that is making you aversive of certain foods? In children, again, a nutritionist would play a huge role. Arti very beautifully explained, how she undertakes that process. So again, an open appeal to all, that if you are struggling, if you with your child with food, please do not hesitate in reaching out. It's not like, parents are born with this inborn hat of having all the knowledge of dealing with their children. If you're struggling, there's no problem in reaching out and asking. And I can already see there are questions coming up, so that's great. So ask. If you don't know, ask. If I don't know something, I will not hesitate. Just because I'm a psychiatrist, I don't know everything. I will reach out to Arti and ask her, Arey, what is the good calorie intake for this and this age, and what should I be eating? Because we are not all knowers, right? So it's best to ask. Now, in terms of treatment for eating disorders, as Arti mentioned, it's a integrated approach. It's not, there are multiple professionals that may be required. So to start off with, yes, maybe a physician who can do a detailed physical assessment to see if there are any new. So they can ask, they will do physically examine you to see if there are any problems with your weight. So they'll, BMI is usually not an ideal indicator of your health, to be honest, because weight in itself is not an indicator of your health. It is your muscle mass, it is your fat composition, body weight composition, all that is important, which determines your health. So the doctor may physically assess you for any nutritional deficiencies, may ask you to do some investigations to see if there are any nutritional deficiencies. Sometimes even the doctor, if he suspects that it's quite severe, then may ask you to do an ECG to see if your heart is functioning well. Bone densitometer may be required to see a bone scan to see, whether you have osteoporosis. An endocrinologist may be involved if there are hormonal problems involved, right? So different physicians may be involved depending on the nature of the problem. But certainly, if it is an eating disorder, then you will need a dietitian or a nutritionist, and you will need a psychiatrist, a psychologist. The role of the psychiatrist is to also see if there are any comorbid, if there are any other psychiatric problems like depression, anxiety, or any personality issues that are contributing, and thereby the requirement of antidepressants or anti-anxiety medications at times may be required to deal with those problems. And a psychologist who can offer therapy. So because, as you see, it is the thinking patterns that are contributing to these faulty eating behaviors. It is a thought behind the behavior which needs to be dealt with, and which then the psychologist, which what we commonly call as a cognitive behavior therapy. So cognition is your thinking pattern, how your thinking relates to your behavior, how your behavior in turn relates to your thinking, and in turn that influences your emotions as well. The CBT or cognitive behavior therapy is one of these talking therapies which which the psychologist can do with this individual to help correct this faulty thinking patterns in order to correct their eating behaviors. Or for people with emotional dysregulation, there can be some other therapies like dialectical behavior therapy, which is a more long-term psychotherapy that an individual may require. So the treatment for established eating disorders are usually little long drawn. It does involve complex interplay of multiple stakeholders. Family may have to be involved, as again, the same things have to be replicated at home as well. It is not just about going to a counseling session and everything gets solved. If the same thing is not observed by family members or by the child at home, then you cannot have a sustained effect. So for treatment to be successful, involvement of all these different stakeholders like nutritionists, psychologists, psychiatrists, physicians, and family are important to bring about good treatment results.
Thank you so much, Girija ma'am. Continuing on the same topic, I would like to ask, since we saw that eating disorder or disordered eating is not in isolation, so how can we support someone with an eating disorder, and how do we know if someone that we know may have an eating disorder? How to recognize the same? This question is to Dr. Girija only.
Okay. Sorry. So how will you recognize if someone has an
How
eating
do we
disorder?
recognize and how to support someone whom we know that may have eating disorder or disordered eating?
Correct. So again, one of the common myths that weight is an indicator of or how you look, whether when you're thin or overweight, is an indicator. Yes, well, it could be an indicator, but it is not the only indicator. Taking a good detailed history is very important. And if you're noticing these patterns of irregular eating very frequently, and it is again affecting their physical health, their psychological health, then how would you recognize? So if the child is being very fussy about eating, is restricting food, is not sitting with the family for eating, is going to his room and saying, "Main khana udhar hi khaun. I don't want to eat my food," is being very secretive about food, or you see packets of food in their room, stacked, hidden somewhere, or you find that there are some pills that they are consuming to lose weight, or you find them 2 hours, 3 hours in a day they're exercising, and so much so that there's no energy left. They become very cranky, they become very irritable. If they're not able to focus, their academics have declined, their social relationships are getting impaired, the relationships with family members are getting impaired, then that should raise antenae. So definitely food eating habits, how they're eating their food, whether you're finding any other signs related to food like food packets, hidden food somewhere, food thrown outside in the dustbin, any other pills that they may be using to lose weight. If they're losing their periods, girls especially, if they've gained excessive weight and again hormonal problems, then definitely think about whether this should raise a red flag. It may not necessarily be always the case, but it should raise red flags. Okay, how would you support? As I said, your eating pattern is just an external behavior. Behavior is your external portal of your mind. But unless you look into your internal portals of your mind, which is your thoughts and your emotions, then you wouldn't be able to support the individual completely. So it's very important that you are mindful of how you communicate with this individual, that you validate them, that you don't dismiss them, that you allow them to express themselves rather than imposing your views on them, so that they're open about what is going on for them. That in itself will be a big step of support that you can offer to an individual who is having eating disorder, which will then further empower them to take the necessary steps of reaching out to a healthcare professional for seeking further help. Because if you're constantly being very demeaning to the individual or disrespectful to the individual will be so in their cocoon that they will feel so even hesitant to reach out for help, even if they realize that they have a problem. So instead, empower the individual by by active listening. Listen to them, not to react, but to really hear them out, and then offer them support by telling them that, okay, if you wish, we could actually reach out to a counselor or a dietitian or a nutritionist, and be a part in their journey of this treatment. So if you're this is an evidence-based thing, and I'm not talking just for the sake of talking. This is something which is research proven, that individuals with eating disorders who have good family support, who have support from their friends, peers, have better results, have good prognosis in terms of recovery. Again, who has problems with eating disorder are not something that go away easily, and they do have a risk of relapse and recurrence. So it is not like I've treated, that means it will never happen again. This is a lifelong journey, and that families need to be very mindful of it as well.
Thank you. Thank you so much for explaining all the domains on all the key people who come surrounding the person with an ED and how to recognize a person with an ED. We are coming to an end with one last question, which I would like to ask to both of you all. So what, according to you, is considered healthy? And what healthy eating habits can be included in someone's lifestyle? What are the basic criteria that we should consider and we should follow?
Yeah, I would answer it. And Trinity, I do understand that our viewers are having, the time which we've already exceeded the time. So I would cut it short and say, see, basically, like ma'am said, so prevention itself talks about a balanced diet. It talks about mindful eating. So when we say what is health, so to be scientific, it is just an absence of any physical or mental disease which is there. So that is health. So when it comes to our health, so it is more beyond the weight, the BMI. So whenever anybody who's concerned about that weight, I really want them to think beyond the weight, think about the body composition. Am I at my body composition, ideal body composition? Do I have the muscle mass which I should be having? Do I have my fat percentage control? So this in itself changes the perception of you to eat right. So if your perception is not related to weight, you will not restrict food. If you're wanting to get to an ideal body composition, you will eat the right type of fats that are required. You will eat the right type of proteins that are required to retain your muscle mass. You will restrict your carbohydrate intake so that you're not getting excess calories. And you're going to have exercise into your lifestyle, which is going to be there. So to generalize, what to eat and what not to eat is really not possible, because there are different age groups, and this is something which is very individualized. But yes, certain things when we think about is uncontrolled eating, or keeping your mind aside, like ma'am said, you get into your emotions and you eat. Emotional eating, what we do is something which is a strict no. Don't relate to food to everything. Your food is something which is going to make you. So respect your food, look at your food, think what nutrients am I going to get, see what healthier things can be incorporated. At the same time, there is one more segment where you become very obsessive and obsessed with eating only right foods, and that again becomes a problem. So don't get into it. So though a particular thing is healthy, how much to eat it. So everything has a rationale to it. And you see a lot of contents which are available already on sites like ICMR and all, which do talk about healthy eating habits. You can definitely refer to it, but with the time constraint that I have, I'll just say that eating right is what is going to make you keep healthy. So eat all the nutrients in a balanced quantity, and for that you definitely would require a nutritionist, and you can walk to us any point of time. So we over here are an integrated family, and we are there to reach out, and for all those people who are at risk or into it, so you're not alone into it. We are there to support you, and definitely we positively believe that this can make a difference, because there's much more to contribute to this entire universe, to India, and let's utilize our skills to in that direction. So this is what I would like to send a message in my last of the question, I feel.
Thank you so much, Arti ma'am. Dr. Girija, would you like to add something to it?
You've talked too much, but as we say, we leave you with some food for thought, but also realize that there are thoughts behind food. So do be mindful of, your eating habits and eat right. Thank you very much.
Thank you so much, Arti ma'am and Dr. Girija ma'am, for giving us your time and speaking in such detail. I'm very sure all of our viewers really had enjoyed it, and they got a good base and good knowledge through it. It was not just a brush up, it was actually the details and the practicality into the topic. And so then the recognition of balance, the importance of acceptance, the importance of being okay with yourself, and finding your own personal needs and requirements, and how to overcome that, what help to seek for the same. Or everything was covered so nicely, and I'm very grateful to both of you all for being a part of it. Thank you so much. I think we'll conclude, end the session here. Thank you so much for all the viewers who gave us your time and your patience. Thank you so much.
Thank you, viewers.
Nidhi, just a minute. I think there were questions that did come in, but I think because of lack of time, we may not be able to answer them.
Yes.
But we'll definitely try to answer them through our either YouTube channel,
Instagram,
or maybe we'll put it on our website somewhere.
Yeah.
We will definitely address the
Yes.
questions that have come to us.
We will try to put it up on Instagram if possible. We will, and I humbly apologize for not addressing those questions. We'll try to put the answers as soon as possible.
No, but you were a wonderful anchor, Srinidhi. Thank you so much for conducting this session. And Arti, you're wonderful. So definitely we'll meet up at SCEW.
Thank you for making a part, and it was really great, Srinidhi. You wonderfully anchored it and got the most out of the conversation.
Yeah.
And Girija ma'am, it has been so supportive and understanding, and because these are two aspects of one thing, and of course, in every aspect of us, we do need you. So we'll be in touch with you constantly again.
I could anchor because I had both very nice orators here who could explain it so nicely. So it made my task so easy. Thank you so much for being so wonderful. Thank you.
Thank you.
Bye-bye.
Bye-bye.
Can I close the meeting, ma'am?
Yes.
Yes,
No, not the meeting. You can close the live, the YouTube live.